Appreciate the struggles to better appreciate the rise. Welcome to Endometriosis and PCOS is Real. Joining me today is a strong, beautiful woman, both inside and out, Miss Dolly. Thank you so much for joining us today, Dolly. Today we want to discuss PCOS with us. We understand that you suffer with this illness, and we would just like to find out from you what's it like having this illness.
To be honest, having PCOS is not a battle for me because I'm just a strong person originally, not like, it don't really bother me to have PCOS. Before my son, it used to get to me that I thought that I could not have kids, but after having him, I'm strong and I beat the PCOS much better than before.
Okay, at what age did you start suffering with this illness?
I found out maybe like when I was 23.
Oh, okay.
Yes, when I was 23, I found out. So all the time I was trying to have a baby, I couldn't have a baby, and that was the problem all the time. And then when I found out, it still wasn't a battle for me because I did not fully know what it was for me to be like scared or anything. And I got treatment from the fertility clinic up north, and then it was an easy ride for me. But other women I know suffer, and it gets to them, and it's a harder battle for them.
How long did it take you to actually be able to conceive with this illness?
Well, on my own, I tried for 3 years on my own.
Oh, okay, wow.
When I got help from the fertility clinic from Charlotte, it took me like less than 2 months.
Oh, so that actually works.
It
So
actually
there
works.
is
It
a-
actually works.
Wow, okay.
With a proper diet and natural medication, it works.
Okay, so how was your partner relating to you knowing that you have this illness? It took you all 3 years to actually be able to conceive, and then you had to go and seek help elsewhere. I know some people, it becomes emotional for them. Mentally, you could be drained as well. What was it like? What was the experience like for
For
you and
me,
your husband?
for me, I was mentally drained, but for him, he don't make anything bother him.
Okay,
You know,
that's nice.
women are more emotional than men. So for him, and he still don't fully know what PCOS is.
Okay, so what would you say to men like your husband, husbands, fathers, brothers, uncles, any male that has a female suffering with this?
I will tell them to take heed and to even go on Google or explore what it is to go through the battle with your wife or your girlfriend, because sometimes she is suffering alone, and that can be even harder for her as
Yes,
well.
because I mean, emotionally, you've
Yeah.
seen you gaining weight from this
Yeah,
illness.
you-
Sometimes you don't know that's the reason why you're putting on so much weight. Some women experience facial hairs. Some of us we go through so many different changes.
true.
Yes, and sometimes men, they don't understand. They make fun of us women, and they have songs about big bone women, and it's sometimes not even that your big bone, it's really just an illness.
Yeah,
But
it's true.
diet wise, because for me, I know for me, I was way back, I was probably 10 when I started suffering with PCOS.
Really?
Yes, so all my life, growing up, I was sometimes big, sometimes small, and everybody was wondering how the fluctuation, because I knew I had the illness. So for me, I started dieting, exercising. What was your mantra like?
When I found out and I went to the fertility clinic, they put me on a diet immediately, which was hard for me because I like to eat what I want to eat. But then I kind of enjoyed it because I know what I wanted. I know I wanted a son, and I would do anything to get my baby. So I would do the diet. I would no rice, no sugar. You see, women with PCOS have to know to fight the battle.
Yes.
You have to eat well and you have to exercise, and it's that simple.
Now, the thing with this as well, after you had your son, did you go back to your eating habits, or did you?
Definitely, definitely. And I put on a lot of weight.
Yes, I know how that is. Especially with the sugar and dough. Sometimes you say it's something you want to cut off as a human being, because it's not really good for you.
Yeah.
Too much sugar, too much dough. But with this illness, when you consume too much, like emotionally it drains you as well. You get tired
Yes.
faster. You get
Yeah,
it's
like this
just a
morning,
whole-
it took me like an hour to put on my makeup, and you get tired, you grow hairs in places you don't
usually,
need.
yes.
You gain weight in the stomach area. Not only that, even during intercourse as well, you don't feel for, your sex drive is so
So low.
low, and the men don't understand that, and they wondering like, are you even attracted to me anymore? And it's not even about attraction, it's just that they don't even know what you're going through.
Sometimes you're not even attracted to your own self and you don't even realize
It's
that.
true.
Yes.
It's true. Sometimes you feel like you're putting on too much weight, you're getting too much hair. Like, what is wrong with you? But it's just all about motivating yourself and having confidence and just going all out for yourself as a person and not thinking about the battle is winning. You have to win the battle of PCOS.
Okay, but yes, that's very true. And for you, you had your son, so you had something to motivate you,
Definitely.
to encourage you. But they have women out there, it's worse for them. They probably don't have that partner. Probably they
True.
feel like they're already too big or they're already too ugly, because that's the feeling you get. You feel like you're not good enough.
To be honest, Anya, it's not even about having a partner. And that's what a lot of women need to know. Like, forget about the partner for a while. You need to worry about yourself. And for my entire journey, trying for a baby, I did it on my own. I exercised on my own. I was eating properly on my own. I was motivating myself because I know what I wanted. Sometimes we have to put the men on the side and think about ourselves. Women like to focus on the man too much, what my partner might think, and if he loves you, he will go.
Accept you for
yes,
however
he
you
will
come.
go
Yes.
along with the ride with you, and he will be there. But anybody with PCOS, like the women out there that has PCOS, has to think about themselves right now and motivate themselves. Go to the gym, get a partner, eat right, do something for yourself. Visit the fertility clinic. Charlotte is beautiful. I think she's great. She helped me throughout the entire journey.
And
It wasn't
took
even
2 months,
about my
right?
partner.
2 months.
Yeah,
you said,
2 months.
yes.
Or less
That's
than
not
2
bad.
months. Yeah.
Wow. That's actually really good. Okay.
And it's not, it's affordable. The price is affordable for a doctor appointment. I think it's affordable. So I think anybody that's battling PCOS should just focus on themselves
Self.
and not on anybody or partner or anything like that.
Okay, so for you, what changes have you experienced in your life physically and emotionally that you cannot overcome right now?
To be honest, nothing drastic. Just the sex drive. To be honest,
You're
Sometimes
still
I-
battling with
It's
your
not.
sex
It's
drive?
not a battle. It's just it's extremely low. It's not as high. Like it's supposed to be. But that's the only problem. I was like, what's wrong with me? Am I not into, that kind of thing? But it's all about the PCOS. It's PCOS.
Yes, because you're tired and
Yeah.
physically you're a mom, so that means you probably up all
And I
hours.
work- and I work
and
late.
then you're a career woman as
Yeah.
well. So for you drained, and then to be suffering is something like that. But what do you find if you go back to your regimen, like when you were eating right, you were exercising, diet, exercise, everything? Do you think that will bring back your sex drive? Do you think it was something that you could?
Maybe I can research on it, but maybe
I think
that's
so.
a good
I
idea.
think-
Maybe
yeah,
I should,
think
but I
it
doubt for
helps.
now. I'm okay. I'm okay with my eating habit. I can eat all I want. I can eat now, but that's a good idea. Somebody that's suffering from that, maybe they can eat properly, and then it's all about the hormones. So whatever you eat, it affects the hormones, and that's why you're always so tired, and that's why you don't have the sex drive up to here, and that's why you're always moody and you're always angry at somebody, and it's so sad. Sometimes it's really bad.
It is. It's something other women, like all women going through it, should be a support system for each other, because like I said, the men may not understand. They have men who really would like to understand. They will give it their all. They will research and everything, but they will not feel what we're feeling emotionally. For me, I would say I can always feel when I'm getting angry, or I am going through the changes of my body emotionally. I can see myself getting bigger. Do you notice anything? Like, is there a point in time that you would realize it's affecting you more than other times?
Like I said, only when it comes to the intercourse part, I notice
So you realize
I'm
when you're
tired.
with your husband,
Yeah.
if it's that time, and then you say, okay,
Yeah.
it's affecting you now, so
Yeah.
probably you need to go back to the drawing board.
or some months I'm smaller than the other
Other
month.
months,
I'm small and I'm big, and I'm small and I'm big, and I'm thick and I'm nice, and then I get back small and I get back sloppy, and it's like, oh my gosh.
Okay, so what's ovulation time for you? What's your ovulation?
After my baby, it was normal, and then after a while, it just collapsed again, and then for a whole month plus, I saw, you know,
A cycle?
my cycle, and I'm like, wow, yeah, and that happened just last month.
Just last month.
So sometimes people cannot even have intercourse or even cannot go to the beach or cannot even have fun because they're suffering for that for a whole month. I know a girl, she suffered that for like 3 months straight, and I'm like, some people have it worse than
Worse than
others.
others, yes, and some of us go through it longer than others. It's something, if you take care of your body, you will not, you may not even remember you have this illness.
Yeah.
Yes, but before we leave or go to our break, do you have any advice for young people growing up? Because that's an illness that us women, we get from someone as young as 9 can go through it. And imagine a 9-year-old going through something. They may not know about the sex drive or anything else, but the period pains, the changes in the body, the facial hairs. What advice would you give a young person growing up?
I would tell them to do a lot of research so they can understand it more. So when they understand it more, they can battle it better.
That's very good. Thank you so much. This has been Endometriosis and PCOS is Real. Please stay tuned. We'll be right back. Thank you so much, Tamika, for joining us, and thank you for your advice. We look forward to seeing and meeting with you again. Girl power.
Yes.
Thank you. Bye.
Bye.
If you haven't checked out Ram J's Auto Parts yet, what are you waiting for? We stock a wide assortment of older and newer model popular car and SUV parts. Suzuki, Toyota, Mitsubishi, Honda, Nissan, Mini Cooper, and lots more. That's not all, Ram J's also stocks truck and heavy equipment parts. And if that won't help you, we also do heavy equipment rental to keep your downtime at a minimal. Ram J's Auto Parts is located Masad Industrial Zone, Grocery. Contact us 450-0495 or 716-1400 or email ramj35@hotmail.com.
Welcome back to Endometriosis and PCOS is Real. And joining me today is a phenomenal young lady. She's a specialist, and trust me, I had the opportunity and the privilege to have an insight with her before the show, and you guys are dying to meet her, believe me. Joining me today is Charlotte. Charlotte, thank you so much for joining me today, and it's a pleasure, a great pleasure to have you on our show today. Please tell us what type of specialist you are.
I am a fertility therapist practitioner, so I deal with ladies that have PCOS, I deal with ladies that have endometriosis, hypertension, diabetes, and any other complication that's affecting their fertility. I also treat men with low sperm count, low sperm motility.
Oh, nice.
So I cover a wide variety of areas, and it's more holistically. So I look at the meal plans, I look at their nutrition, I put them on progesterone therapy, I cover a wide area of treatments.
Oh, that's actually good. That's amazing. Wow. Looking at you, I would never think so. But tell me, dealing with endometriosis and PCOS patients, how has it been for you? What type of patients do you see rather? What type of patients do you see? What's the age range? Tell us a little more about your patients and what advice you give them.
Many different types of patients. I have patients, people that are overweight, I have people that have other complications, I have different ages. I see teenagers that are still at school that have PCOS. I see older ladies dealing with endometriosis. I see ladies that have PCOS and they're underweight. So there's no clear picture to define PCOS. Anyone can have PCOS and anyone can develop PCOS at any time, and it's very much linked to diabetes and insulin resistance. So what you see is we have the highest rate of diabetes per capita here. So we're also experiencing a big build-up in PCOS ladies that are coming to me because of this link with the diet that we have here in the Caribbean.
So it is true, like the diet and exercising, it actually helps.
Definitely.
Can it reduce the number of PCOS and endometriosis patients we have?
It definitely can. Diet is a big factor when you look at what's causing PCOS in particular. It's all about insulin resistance. So changing your diet, cutting out the white flour products, eliminating a lot of the sugar products and stabilizing the blood sugar helps a lot. It's linked to your hormones and it does regulate your cycles, your menstrual cycle. With endometriosis, it's a little bit different. Endometriosis is where you have the uterine lining growing in other areas, not necessarily in the uterus. It can be found in your ovaries, in your tubes, and most ladies with endo, they experience very painful periods, often infertility because the embryo has a hard time to attach when there's a lot of scar tissue and very heavy periods.
Yes, but and you help individuals or ladies, families, because both men and women suffer it. It's not just women. Because I say so because you have husbands who trying to start a family and perhaps the wife may be infertile, and then we go to a doctor. Then we would hear a doctor say to us, well, you cannot have a baby, and then the family is going through this emotional wreck because of that. But you now have come and saved the day for all of us, and you have opened up a way to encourage us and motivate us to let us know that there is still hope. In other words, that's what you give us. You give us hope.
It's definitely
How
still
do
hope.
you do that? Given endometriosis is a bit different, like we said, the lining of the womb. So what's it like dealing with a patient, who has endometriosis, trying to have a baby? You see months passing by. What's it like?
It's important to deal with every aspect, to look at the woman and look at whether she's suffering with depression, anxiety, all these other factors come along when someone has told you maybe you can't have a baby, you're infertile because of so and so reason. And that's important to look at that and whether their stress factor is causing a problem with their infertility as well, because we have ladies that can get pregnant with endo. There is no cure for endometriosis, it's mainly managing the symptoms. So we look at acupressure, which is a form of traditional Chinese medicine. That's what I practice here. And we do changes in diet as well, and avoiding toxins as well, especially for persons with fibroids. Things like bleach and the bot spray, anything that has toxins in it can contribute to fibroid growth. So we look at their environment, the environmental factors. We look at whether they're emotionally in control, depression, anxiety. We cover everything holistically to try everything we can. But if there is scar tissue in the way, then the embryo will not implant. So then we look at referring to Barbados for IVF or any other procedures that we can use that can't be used in St. Lucia.
Oh, nice.
Yeah.
I'm so glad to have her on the show because she's given us a medical point. And earlier on, we spoke with Miss Dollhouse. We spoke with Dolly, who said her experience. She shared her experience with us as a patient. I can only give my story as a patient, but having the medical background, it's actually making it a little easier for me now as a patient to hear like there are ways for me to be able to control the illness. And I'm almost certain any other young lady out there going through it would feel the same way. You said the treatment in Barbados, right? Is it that we don't offer it here?
It's IVF, so it's in vitro. So this is done only in Barbados at the moment. It's not done in St. Lucia presently, although it's something I want to bring down. Me and myself and Dr. Gilbert for Sunrise, we have been discussing this. And it's definitely something that's needed here for sure.
It is. It's definitely needed.
Definitely.
Because you have young people, as in small as 9 growing up, and they're scared when they hear these terms. When you hear a doctor tell you you have an illness and
there's no solution on island that can fix it. I mean, luckily with PCOS, if you haven't got any other medical conditions and you've done a HSG, which checks to see if your tubes are clear, we can, as far as we can, we get about 80% of our ladies pregnant. So between myself and Dr. St. Rose, she'll prescribe fertility drugs like Clomid, Letrozole, and with change of diet, I'll be dealing with the holistic side, and we have a really good outcome success rate. So.
And you said 80%?
Yes, for our PCOS ladies.
So the others, they can't?
They're over 40 or they have other medical problems. So. Yeah.
Okay.
Yeah.
When you hear over 40, I mean, there are ladies out there over 40 trying.
Still getting pregnant.
But yes.
With PCOS added on and other.
But that's different to hearing that you 20 or you 18 and you cannot conceive. I know for me, I had surgery when I was only 12 for that endometriosis at the time. And after endometriosis, they said I was getting PCOS from it. So then when I got the two, I'm seeing at 12 years old, I'm getting fat. They told me I started getting facial hairs. They told me my skin might break out. There were so many things, and I remember as a child growing up, I looked for it as before I saw a pimple on my face. Instead of thinking, no, I'm a young girl growing up, I would get a pimple or two. I'm thinking, oh my gosh, my illness is on me. So what advice would you give to other young patients like myself growing up into that? I don't want to call it an illness, but the condition. Yeah,
we call it a syndrome because it's an umbrella of symptoms. You don't actually have to have the cyst on your ovaries to have the PCOS because it's a syndrome. We normally look at blood tests as well, like we do a day 3 blood test to check your luteinizing hormone, your follicle stimulating hormone, and your prolactin levels. And the ratio between the FSH and LH can determine that you have PCOS, but not the clinical signs. So some people might go for an ultrasound and be all clear, but still have the syndrome. So with our younger ladies, we see a few students actually that have PCOS, and we try not to make the focus on all the negative parts. We would treat them with progesterone therapy. We won't put them on a pill or anything that's too strong or can affect them in other ways. We use something natural which brings up their progesterone levels, so it brings down their testosterone levels, so it helps to reduce the facial hair and the acne as well. And we just focus on what's positive. What can you do? What exercise can you do? You can eat healthy. We give a positive outlook. We don't focus on you're going to have facial hair, you're going to get all these pimples and you're going to put on weight. We don't focus on that. We keep it very positive.
I wish you were around when I was a child. I really do. But would you say having endometriosis or PCOS is linked to someone getting PPD, postpartum depression after birth?
Not really. No. I don't think there's a link. I wouldn't. No, definitely not. PPD, it's more emotional, and the other ones are more physical, and it's to do with metabolism as well, especially the PCOS and how your insulin resistance is responding. So it's not linked to any type of mental health condition. It's definitely something that's environmental. It's what you're eating, especially with the PCOS. Endometriosis, it can happen to anyone at any time, and there's no cure for it, and we don't really know why it comes about either.
Oh wow. Yeah. Okay, but when as a young lady, you're hearing that you cannot conceive or you cannot have that family that as a little girl you dreamed of, right? Imagine now, today or tomorrow, you pregnant. Because a lot of cases, I've heard so many young girls talk about that. They went to the doctor, they cannot get pregnant. Within a year or two, they come back and they say, they're pregnant and they thought they couldn't have a baby. How the transition from not having the family ever into having a family. Do you ever have patients like that? Like, what advice would you give somebody? Because that's a whole different mindset. That's somebody that was not prepared to start that family, but that was somebody who they just thought they could not have that family. And there they have the surprise in front of them coming into the world. What advice would you give someone like that?
I just think a lot of doctors, when they're diagnosing the patient with PCOS, they need to be a little bit more sensitive, and instead of saying things that I hear like, you can't have babies, you're unable to conceive, that can cause a lot of issues with the patient. It can make them depressed. It can make them feel, unworthy as a woman, because as a woman to bear a child, that's one of we want to do, right?
Yes.
So it's just the way that it's put to the patient. I think sometimes it needs to be said that it's possible it might take a little bit longer, or it might be a little bit harder to get pregnant, but it's not impossible unless there's actual real evidence, like the tubes are blocked from a HSG report that's showing the fluid is not flowing through. Then I don't think that should be said to anybody, because there are possibilities. And then that lady might go off then and believe she can't get pregnant, so not use protection maybe, and then end up with a child she maybe didn't want at the time. And so it shouldn't be said you're not
really
able to
shouldn't be.
conceive.
I mean, Tamika did express that they told her she couldn't have, she was having difficulty conceiving. I was told I couldn't have, and I have a gorgeous little boy at home. So for me, I think doctors as well, they should be so careful in their choice of words. Instead of saying that you cannot have a baby, more difficult. I think that's the word they should use. It's gonna be difficult, but the possibilities are there.
I mean, I understand the doctors they're busy and they don't deal with more of the emotional side of things as a therapist would. So at that point, it should be said, it's just, like you said, it's going to be a little bit more difficult. And Tamika came to me the same way, very, upset and, really wanting to have a baby. And within 2 months, we did things with her. We changed her diet, we put on progesterone, and she got pregnant. So,
and it only took her 2 months.
Yeah.
But what would for somebody else, another patient, it could take them longer. Now imagine them, they would get frustrated. They would say, well, this young lady took her 2 months, or this other lady took her three months, and for me it's taken an entire year. Wouldn't that bring on additional stress? And
definitely.
So how do you as a specialist deal with patients?
I'm a therapist as well, so I deal with that side of things when I feel frustration, I feel the urgency that they want to get pregnant and the disappointment that they're not getting pregnant, and I encourage that they just practice relaxation therapies, because when they're stressed in itself, it produces a hormone called cortisol. So when that starts to come through the body, that stops ovulation as well. So the whole fact of getting stressed and worked up is not going to help the fertility issue at hand. So we deal with stress management, we deal with PCOS management, and we make sure that the patient is not stressed whilst they're going through the therapies. And we always say to people, we can't determine exactly how long it's going to take for you to get pregnant. It all depends on what other medical conditions you have, what's going on in your life at the moment. Are you stressed? Are you depressed? Do you have panic attacks? All these things are important. So not everyone is the same. Everybody is different. Everybody has different blood pressures, weights, and so on. So not one person, we can't say it's going to take a month or 2 months. It depends on the individual.
Thank you so much, Charlotte. You actually brought hope to me and other young ladies out there. There is still hope. You can still conceive. You just have to check out Charlotte. Where are you located, Charlotte?
Rodney Bay Creative Health Centre.
Okay, well, there you have it, guys. It was a pleasure having you. I do hope to have another interview with you and get a little more insight into your world. It seems very interesting on my end.
We can go
I'm
on to
sure
male
everybody else.
infertility.
Sorry?
We can go on to male infertility next time. Male
Oh
factors.
yes, we can. That would be, oh wow, guys, we have it there for you. We're coming your way very soon. But thank you so much again. It was a great pleasure, like I said, and I look forward to working with you again.
Yes, same to you.
Thank you so much, everyone. This has been Endometriosis and the PCOS is Real. See you soon. Bye. Appreciate the struggles to better appreciate the rise.